So what do I do if my baby's got bronchiolitis? The good news is that most cases of bronchiolitis are actually quite mild and they tend to get better around 3 to 7 days without the need for antibiotics, as remember, they're caused by viral infections and not bacterial. However, there are a few cases that can progress to get worse and become a bacterial infection where you would need antibiotics. And therefore, you should see a doctor, especially if your child was born premature, your child is under 3 months, or your child might have another underlying medical condition. Now, you might make a decision of whether to call an ambulance or can you wait a few hours to see the GP. Now, this will depend on how anxious or worried the parent is and how experienced you are in dealing with a child who's got bronchiolitis. It also depends on how severe the symptoms are, because a child with bronchiolitis can deteriorate quite quickly. So if you notice your baby has a high fever of 39 and above, your baby is dehydrated, your baby is wheezing, you notice flaring of the nostrils, sucking of the muscles under the ribs, grunting, and labored fast breathing, it is wise to call an ambulance. For mild cases, certain home treatments can be helpful. You can give Calpol or ibuprofen if your baby's temperature is too high, above 38 degrees centigrade for instance, or your baby is distressed or crying. You can give your baby nasal or saline drops containing sodium chloride, which helps to unblock the nose and allows the mucus to drain. You can apply the saline drops 20 minutes before a feed, as a blocked nose can cause your baby to struggle with feeding, and you can also apply it before they're due to sleep. Steam inhalation also helps, so you can put your baby's cot close to you while you're having a shower, or giving your baby a warm bath, as the steamy environment helps with the airways and cough. Keeping the room warm and moist also helps with the airway, and if your baby is struggling to feed, keep trying to encourage small amounts of bottle milk feed or breastfeed, as this helps to prevent dehydration. Try keeping your baby in a semi-upright position in the cot while the baby is asleep, as well as during feeding, as this also helps with the breathing. You also want to prevent others from catching the infection, so remember to cover your child's nose and mouth, especially when they sneeze or cough. Don't think your child is too cute that you cannot cover their nose or mouth. Also, get rid of any used nose tissues or handkerchiefs so that another child does not touch it. Encourage good hygiene by washing your baby's hands and your hands also. And this includes anyone else that comes in contact with you or your baby. You should be letting them know to wash their hands. Make sure you clean and wash objects such as toys, clothes, cutleries. And if your baby was born premature, then it is wise to avoid crowded or public places and keep them away from anyone with a cold for at least the first couple of months, as they are prone to infection at this stage. Finally, it is best to keep your unwell child at home and away from others, especially those who have a low immune system, could be grandparents or anyone having treatments such as chemo, until your baby's condition improves. Now, I hope you found this video on bronchiolitis useful. If you have any questions, please drop some comments below.